to just better contextualize this plenary session. So deliberative polling is an attempt to use public opinion research in a new and constructive way. Specifically, the polling process hopes to reveal conclusions that the public would reach if people had the opportunity to become more informed and engaged by particular issues. Subsequently, the questions and proposals provided have been constructed by Stanford students within a class setting to have a better pulse on the thoughts and feelings of the current undergraduate population in regards to Stanford-specific and national level issues. In addition, we hope to potentially use this data collected from this poll to provide university level administration information about said student perspectives. With that being said, yesterday's plenary session was devoted to receiving supplemental knowledge about Stanford specific issues, with this plenary session being devoted to the discussion of national issues, specifically in reference to the COVID-19 outbreak and accompanying governmental responses. Without further ado, I would like to introduce our panelists. Starting off, we have Dr. Merrill Matthews, who is a PhD, and he is a residential scholar with the Institute for Policy Innovation, a research-based public policy think tank, and a past president of the Health Economics Roundtable for the National Association for Business Economics. He's an opinion contributor to The Hill and served for 10 years on the University of Texas Southwestern Medical Center's Institutional Review Board for Human Experimentation. Now I'd like to introduce Santa Clara County's Board of Supervisors President, Cindy Chavez. She's a prolific policymaker on everything from affordable housing to women's issues, as she represents close to 500,000 people in some of the most disadvantaged areas of Silicon Valley. She is the chair of the Valley Transportation Authority and serves on the Caltrain Board of Directors, the Bay Area Air Quality Management District, and the Association of Bay Area Governments. Throughout the session, we might also have Dave Cortese, who also serves on the Santa Clara Board of Supervisors. However, we're very delighted to have both of you here to help serve as our panelists. So without further ado, let's start the questions. So first, our first question, which either of you can answer, especially within the scopes of like your roles, is from Kendall and Group A. In regards to the COVID-19 outbreak, who would have access to the data stored in contracting and contract tracing applications / devices, given that that's one of the particular ways that we've been seeing governments might want to respond? And how will governments ensure secure storage of this data? And could it be used by law enforcement to also see if people are social distancing?
Who would you like to go first?
And whoever feels most comfortable.
Well, I'll take a shot at it. Thank you so much for having me. It's a great pleasure. I've been doing a lot of Zoom conferences here lately. Didn't know we could do that until we've made this, the lockdown has made this a standard procedure, and it's actually worked fairly well. But thank you for having me, Joe. The question on the contact tracing, what the epidemiologists feel like is if something is very, if we are at a situation where the pandemic is growing and spreading, they need to be able to reach out to people and contact them and let them know that they may have been in contact with somebody who had a contagious disease and they need to either self-isolate or do something of that nature. And technology is helping with this because there are apps now where people can opt in, go into the app. That app can trace where they've been, send that information to certain people, which makes it easier for the usually the county or city government to be able to contact those people and let them know that they may have been in contact with somebody who had a contagious disease. The question that's being raised is, could this be used for nefarious purposes? And secondly, could we actually, could the government come in and force you to have this app so that it can automatically trace everybody? I'm fine with an opt-in version of it because you're making a decision that you want to be able to do that. It's not clear to me that the government has the authority or the ability to be able to step in, the legal authority to be able to step in and do that. But then 2 or 3 months ago, I wouldn't have thought the government had the legal authority to lock down the country. So we're learning how much we can do as things go on. Whether or not the government could have access to that, that is actually an interesting question, because there have been several cases in which the government has wanted to have access to, say, for instance, a criminal's iPhone, or alleged criminal's iPhone. They go to, say, Apple and say, give us the code to be able to get into this. The private sector companies, telecommunications companies, have pushed back on this. They don't want to be in the middle of this, because they want, part of their brand is, we provide security. And so they pushed back against doing that. I know in a couple of cases, the FBI, I think, was able to break the code anyway and get into the cell phones. But that's a challenge we're going to see coming forward. And I suspect not just in this, but in other ways as well. So the opt-in thing, I think, probably works well. I would be a little cautious about going too much further than that, because I think, especially with some of the things we're seeing from the FBI right now, it's not clear that the organization is as trustworthy as we had hoped they would be. We may find out that's wrong, but it's not clear that they are as trustworthy as we had sort of thought they might be.
And Joel, and I see Supervisor Cortese has joined us. I'm excited to see him here. He has been a longtime member of the board, and I'll let him get a chance to introduce himself. But just to, I really appreciate Dr. Matthews going first. I wasn't sure I heard the question properly. So let me just talk about what's happening on the ground, and that might help shape some other questions that you get. So here in Santa Clara County, our goal is to put together a team of between 800 and 1,000 people that can support our contact tracing efforts. The way contact tracing works right now for counties across the country, they have relatively small labs that really focus on things like hepatitis and other kinds of contagious diseases that once they find them, it's a relatively small group of people that they need to find. And when we do that, it's to protect both the public health, to make sure that that individual knows that they're contagious, and that people around them understand what the implications of that are. Now, the bigger question that's being asked is, in that process, how are we using public data, and what are the ways to protect the public from government being overreaching or being too intrusive? The thing that we have been very focused on as a county is being really, really disciplined about how we think about public data. In fact, as a part of our contact tracing work, everybody who's participating in it will be trained as to the rules regarding HIPAA, so that they're not sharing inappropriate information with anybody that it doesn't need to be shared with. And this is a big balance between protecting civil liberties and also protecting public health. And so I think what Dr. Matthews hit on that I think is really critical is that because we never, there's a lot of things that have happened that I didn't expect either. So we are in a constant kind of struggle to balance the protections of individual privacy with public safety. And one thing I wanted to let Supervisor Cortese chime in on this about is a rule that the county has relative to registries. It's really, really critical. But just to wrap up, I want to give you an example of how we're going to access this data. So one is that we are partnering with high-tech companies that are helping us with apps that allow us, once we have identified somebody who is COVID-19 positive or at risk of being COVID-19 positive, that we're able to use an application so that we can track the research that we're doing. So we're not tracking everybody in the world and people aren't opting in, but once we found someone who's COVID-19 positive. An example of that is if we go to a workplace that's now allowed to be open, we're not telling that workplace, give us everybody who works for you, give us all their information. What we're saying is, person X was in your building on Y date. Give us the sign-in sheet for the date so that we can reach out to them and let them know they may have been exposed. That's our strategy. But the county has a history here of really protecting individual rights, particularly as it relates to faith. And Dave, if you're on, maybe you can talk about the registry policy that we have, because that may inform how this gets applied at a local level.
Thank you. Thank you, Cindy. Thank you, everyone, for inviting me. I'm Supervisor Dave Cortese. It's actually spelled with an S, although you have the phonetics correct. Cortez. It's not a problem. Just want to point that out in case anybody's actually, taking notes or recording names, rank, and serial number, and all that good stuff. Speaking of name, rank, and serial number, what Supervisor Chavez was indicating is for reasons completely pre-pandemic and unrelated to the pandemic, frankly, more related to religious persecution here in Santa Clara County and across the country, as well as issues around sanctuary policy. I brought forward an initiative with Supervisor Chavez and my colleagues supported just about a year ago, maybe a little bit longer, which put into place a registry ban in Santa Clara County by ordinance. So what that means is nowhere in our system are any of the 40 county agencies or departments, and that would include justice, that would include behavioral health, mental health, drug and alcohol, parks department, you name it. They can't keep registries by category of race, creed, status, ethnicity per se, and so on. I don't really need to name all the protected classes or categories, but it would essentially be those of you that are familiar with constitutional law generally would consider to be protected classes. And beyond that, it really, I think the idea is we don't want to be in a position of having to turn over registries to somebody, either from a police state standpoint or just on a California Public Records Act request. In California, anything that is public, is easily obtainable, and in fact, government's required to turn it over. So if we say it's not a public record right from the beginning, essentially what we're saying is it doesn't come under those policies. You combine that with what Supervisor Chavez was talking about during the pandemic with regard to trying to do contact tracing, which is obviously a huge privacy issue, as you've been talking about. It at least creates a situation where even if inadvertently a registry was turned over, somebody turned over too many pages from the local church or temple to the county would not maintain that registry or even that sub-registry by law. And by law, it would not be considered a public record, so nobody else could get their hands on it. It certainly would not go into our justice system. When I say all departments and agencies, that includes our jail and justice system in Santa Clara County. You could walk into the sheriff's department or the jail and say, we want to know how many people are here based on this, based on registration intake requirements. At intake, how many people did you intake who did not have citizenship status, for example? They'll say, we don't know. We don't ask, and we don't know. And we won't maintain those records. And even if someone did tell us, we won't maintain the record. But when you get back to the pandemic, I think, and I'll leave you with this thought, because I don't even know how long I'm supposed to be speaking here, but let me leave you with this, that it would not be the problem at the county, at least in this county, where we have a robust health and hospital system, one of the largest in the country, and everyone's trained on HIPAA, even us county supervisors. There won't be privacy violations around medical records or health records because we don't know what we're doing, or because we allow it or relax, or we didn't think it through. I mean, I think what everyone has to worry about is breakdowns. I mean, if you're doing thousands of contact tracings, and you're utilizing everything from everyone from college students to retired county employees, I mean, does somebody just, you can have human error. And then what happens at that point, and do the liability issues, which are severe, under those federal privacy laws, cause everyone to stop? Does that bottleneck the process at some point and become a huge policy conflict? So we'll see. This is all uncharted territory.
Okay, thank you all for answering that question. Just to be able to retroactively introduce Supervisor Cortese. Dave Cortese has served on the Santa Clara County Board of Supervisors for more than a decade, with 4 years as and prior to this, he has served 8 years on the San Jose City Council, including 2 years as vice mayor. So I just wanted to say on behalf of the team, Thank you so much for being here.
Thank you.
And so now on to our next question. Okay, so there are quite a few questions about mechanisms about how the government may enforce stay-at-home orders. So one of them is from Shreyas in Group K. They say, or they ask rather, what other mechanisms beyond imprisonment and fines does the government have to punish citizens for not complying with stay-at-home orders? What are governments, specifically Santa Clara, what is Santa Clara doing, as well to protect marginalized communities that might be disproportionately affected?
Those are excellent questions, and I'll go ahead and start since it had kind of a local flavor to it, Dr. Matthews. So first of all, in Santa Clara County, and I apologize for continuing to be so local. I know this had a national intent around it, but I can only talk about what we're practically doing on the ground here relative to these kinds of issues. So we had a goal of having robust compliance through education. So we have, if you look, you'll see that we have had a lot of social media, a lot of very short videos, TV, radio, to explain to people why we were doing what we're doing. And once that shelter in place order came along, really helping people understand the importance of it. And because of that, we have had incredible compliance. I mean, literally robust compliance. While we do have a lot of complaints and concerns, we have been less focused on individual behavior as we have been organizational and institutional behavior. So for example, in our county, as part of the 6 Bay Area counties, you may all know that our 6 health officers have been acting together and collaboratively as they've been putting forward their health orders. One of those allowed us to keep public works going. It then took back some of that and then expanded it to allow all construction. So in that instance, what we're doing is we, as part of allowing construction to come back into being, we required contractors to hire third-party assessment folks, investigators, for lack of a better word, to go through the job sites to make sure that they were following social distancing. People were wearing masks. There were places for them to wash their hands, so that we could allow as many people to get back to work as we possibly could. So really it's robust compliance. The bigger question, and I think it's a really profound question, is what are we doing for communities that are lower income and communities of color, particularly where we've seen a significantly high death rate and a higher infection rate. And to be frank with you, we are working very hard to get out into those communities to have conversations with them. I mean, we've been using media. I brought forward a referral with the support of my colleague to instruct the county to hire 200 promotores, and that's a part of from a health perspective, these are community public health officers. I mean, not officers, but activists that would go out and do education and be able to give masks to communities that don't have them and be able to do education for them and small businesses. And again, our goal is not to fine or imprison. It really is to educate and earn the trust of the public to earn compliance.
Yeah, if I'm to answer very quickly, Supervisor Chavez obviously covered, I think, most of the ground there. There isn't a lot that we can do, and there probably shouldn't be. But again, I probably speak as somebody, as a trained attorney, fairly steeped in constitutional law. You know, I think it's all right. We need to err on the side of protecting First Amendment rights, the Bill of Rights. Obviously, you can't scream fire in a crowded theater or, put obscenities or pornography out there. There's some limitations, and that's a delicate balance. And of course, the courts have recognized that we have to have some limitations under certain circumstances. And I think this is the balance right now. What kind of authority should you have to limit people their right to assemble, their right to congregate in religious centers, practice their religion in groups, etc.? I mean, right now, one could argue that we're trampling those rights, but in a pandemic, when it's a life or death situation, at least in the past, the courts, have upheld the notion that some limitation is appropriate. I will tell you, and I think Supervisor just mentioned it. There's in real life, real time, even with the scofflaws that are out there, unless it's blatant, egregious, and repetitive, there hasn't really been much of the DA type of enforcement going on. And she spoke to it. We're both very, very concerned about the ethnic and racial imbalance, which is, I think, a historical problem that's rearing its ugly head once again. But I'll leave it to that for now.
And I'll weigh in on this. I think that's absolutely right. The issue that of course, the governors are the ones that set the rules, and so the rules change from state to state as they were looking, and as they're sort of expanding what normally would be considered constitutional in the lockdown. You can't go to work, you can't assemble, and so forth. Many of them have put in various ranges of penalties. I'm in Texas, where there was a penalty of both a $1,000 fine and up to a month or two in jail, I believe it was. And of course, we had if you've seen it on the news, we had a salon owner decide to defy that before the opening of businesses was relaxed some. And she did that for about 3 or 4 days beforehand. They gave her a citation. She went in public to a crowd and tore up the citation in front of all the press, and that got her arrested. She went to trial. The judge fined her a week in jail and $1,000, I believe it was. And the governor came up and immediately removed the penalty of going to jail. The attorney general came back and agreed with that, and so the person was immediately let out. Had she given the authorities the ability to be able to sort of overlook it a little bit, maybe they would have let her pass, because the end of the time was coming anyway within a few days, but she didn't. She did it very publicly. But that forced the Texas legislature to say, we don't want to throw people in jail for this. But it gets back to that point. How do you enforce something that's a strong mandate, and yet you don't really want to be out there arresting your population for going to the park or talking to somebody or something of that nature? It's a tough situation. I think that, to your point, when you say within limits or something, the longer we go, the more you're either going to have to relax it or enforce the penalties, because people were willing, I think, to go along with it pretty much for 30 days, 60 days. At some point, they're getting to the point where they're saying, we've got to get back to work. And then that issue comes in, I think, in even a more stark contrast.
Okay, thank you for those answers. It seems like we have like a decent amount of questions left. So I might just like request that for each question, maybe only 1 or 2 people answer, just to make sure we can get through some of these questions. But thank you all so much. So another really good question, kind of going off of the discussion that y'all were previously having, was what kind of legal precedent does it look like some of these restrictions will have, such as we're in talks of having a mandatory vaccines or stay-at-home orders. What does this look like in the future, given the legal landscape?
Well, I'll jump in on that, because of the vaccine issue. I've been looking into this because, as some of you are probably aware, there's a portion of, and the Mayo Clinic is this, we won't solve this problem until we get a vaccine out there. And that got me thinking, all right, what is our vaccine utilization right now? So I went to the Centers for Disease Control and looked at it. Roughly for this year, they expected about 43% of adults age 18 and over got the flu vaccine. Now, I'm one of the first one to get one when they come available. But 43% of the adults is a low percentage of people, and that's been true for a decade. It runs between about 43 and 45% that get the flu vaccine. We know the flu, it comes every year. We know typically the flu vaccine is going to help you. It doesn't cure it, but it helps you with the symptoms if you get the flu, and may help you keep you from getting it. And yet we have a very low take-up rate. When you get to seniors with the shingles vaccine that goes against shingles, 1/3 of them have gotten that. So we have a fairly low vaccination take-up rate for adults. For children, because they have to have it in order to go to school, you have a much higher rate, but for adults, it's a fairly low one. So I'm wondering myself, if you don't have a mandate, and I'm not sure I'm a fan of a mandate, but if you don't have one, does the vaccine actually become the solution to the problem that I hear so many people think will be, or that it will be?
I don't have anything to add to that, Dave. I don't know if you do.
I mean, it's a huge, again, a huge ideological issue, and I think the good doctor just laid that out for us. It's, I mean, since Ben Franklin, said that, cautioned us not to give up liberty for security, for personal securities. This country's been very, very diligent about these kind of issues and making sure that we err on the side of personal liberty. So once again, we're going to be faced with that challenge. That's all I'd say. And this is an evolving issue. And as I said, it was just laid out beautifully.
And, I'll just add one more thing. I took a quick survey, just a completely informal survey of several people I know, because there's a small percentage of people who are adamantly against vaccines. And that's been true forever, but it's for the last 20 years, there's been a small group that are adamantly against it. But most people just are somewhat lackadaisical. So I took an informal survey of several people I know. I'm the only one who got the flu vaccine this year. You had young people, older people, none of them, they just didn't get around to it, and it just wasn't something they, in fact, one of them has never had one. One of them didn't have one since 1996. In fact, two of them never had one. So it's interesting to see how low the vaccination take-up rate is, even with something as known, as cheap, and as accessible as the flu vaccine.
Okay, thank you so much for the inputs on that question. So we're gonna kind of pivot to more economic related questions. So let's see. There's so many good ones here. So here's a question from Gracie in Group B. She asks, can we expect the COVID-19 vaccine, once developed, to be free to the American public? And will this be determined at a state, national, or country level? If not, does it look like there could be subsidies?
I mean, I'll jump into that one. I think that's hard to know. I think that the federal government in particular has really been kind of swinging from idea to approach. And I just want to follow up on something that was said earlier. In the state of California, and I don't know this across the country, but the way our mandates are given out is the state can give them as well as local government. Our public health officer has an awful lot of power to make mandates. I say that because in this instance, one of the things that I would be really interested in us figuring out is, again, how you get robust compliance through education. And I think that with the number of people who've died and even in our own county, that I think there will be a high level of interest for people wanting to get the vaccine. I think we have an obligation to make it easy for as many people as possible to get the vaccine so that we don't stop the economy again. We have a heightened level of interest. So from my perspective, my hope would be that the federal government would make this free to get people to actually utilize it quickly and robustly so that we can continue to open up our economy. Now, I know the vaccine's a long way off. So let me just draw a distinction for a moment to say that I don't know when we're going to have a vaccine. I know no one knows the answer to that. I do know that for us at a local level, having robust contact tracing is a way we're going to address that problem, because otherwise we could be waiting forever to move forward.
Joel, can I just also, I thought that was an excellent response from Supervisor Chavez, but also to tie it back to the earlier question in terms of ethnic and racial disparity, because to the extent cost gets pushed down to us, to push down to states, and counties are effectively subdivisions of the state with hybrid financing. Some of our money comes from the state, frankly little, but most of it comes from local tax revenue and so forth. In our county, with our board, at the risk of speaking for all 5 members, I would say that we would invest pretty much on a blank check basis to get everyone vaccinated. We probably just open up the county fairgrounds and say everyone line up 6 feet apart and we'll start vaccinating, we'll pay for it. But what happens in counties where the tax base is not as strong, and in those counties where you have greater poverty, and in those counties where you have greater racial disparity and people of color who suddenly can't get the vaccine because it either costs them money that they can't afford, they don't have health insurance, they don't have access, or the county just can't afford to do that for them. I think that's something to watch, and I just wanted to try to link those 2 questions and answers together because these things are related.
So and let me weigh in on that also. The issue on the vaccine, the Affordable Care Act requires all preventive care to be paid for by the insurer. So that vaccinations are considered preventive care. So if you are roughly, you've got about 29 million people who are uninsured right now. The rest of the country has either employer-based insurance, they buy their own insurance, they have Medicare, they have Medicaid, or they're in the military. All of that will be covered under the Affordable Care Act because it's preventive care. So you do have the issue of the uninsured. Those tend to be lower income people and people of populations of color and so forth. So, but the point being is it mitigates some of the cost for the county and the government in the fact that you've got a fairly small percentage of the population, about 8.5%, who are uninsured. Some of those people are not going to come get a vaccination regardless of it being free, just because they're either marginal or other things. But you should be able to afford a free vaccination for a percentage of those low-income uninsured people, and that would not cost us a great deal.
Thank you for answering that one. The next set of questions has a lot to do with the Emergency Money for People Act that's been in a lot of discussions currently. So speaking to the best of your abilities, so one of the questions comes from Carter from Group A, and they ask, given many of the plans of the government giving out money or paying for treatments, how does it look like this can be paid for? And what are short-term and long-term consequences of increasing our national debt substantially in reference to that?
I'm not sure.
Can I be kind of, Supervisor Chavez might not appreciate it. She's the president of our board this year, and she's we're all trying to preach hope and optimism, but on the fiscal issues, I've been preaching a little bit of doom and gloom lately. The federal level, the saying is that they print money. The federal government is allowed to operate literally at a deficit. The budget doesn't have to be balanced. So I just want to talk just structural fiscal issues here for a moment. At the state level, as far as I know, all 50 states, but for sure California, which is where we all are, has to balance its budget, meaning you can't have less, you can't adopt a budget that has less revenue than you have expenses. Obviously at the federal level, we've been doing that off and on for years and years and years in the trillions. At the county level and the municipal level, it's the same thing. You have to balance the budget. And we do that on a fiscal year that starts July 1st. It's coming right up. Our county is currently forecasting for the first time in years, not only is a deficit, but a deficit of about $270 million, $250 million against an $8 billion budget, and that may grow. That's different than the cost of actually responding to COVID. The cost of responding to COVID are the things we've been talking about, like purchasing vaccines, purchasing PPEs, and so forth. You do that, COVID dissipates, you're done with that. But once your revenue drops because of economic devastation, which is what's happening now, you have nowhere to turn, and you have a potential train wreck coming of counties, even ours, in the wealthiest metropolitan area in the world, reaching a point where we are cutting our budgets so drastically that we can no longer provide the safety net services that all of you are going to be wanting us to provide. And imagine that at the state level, where currently there's a $58 billion deficit, And to put that deficit in perspective, it's 2.5 times the deficit that got Gray Davis recalled a few years back. So these are, we're going to get beyond the issue of who's going to pay for things very shortly here to the question of, can anybody afford to pay for things? And is the federal government going to step up and continue to help like it has been or not? And that's really the big question in my mind.
I don't really have anything to add to that.
Yeah, I agree with that. Thanks.
Thank you. So the next question is, okay, so given that the Emergency Money for People Act is in current discussion, does it seem that payments of $2,000 a month could be accompanied by other measures like a national or even state level rent / mortgage freezes?
Joel, was the last word you said freeze?
Yes.
So let me tell you what we've done at a county level, and then Dave, maybe you can just talk a little bit about the what the constitutional issues are here. So what the county did was we have an overarching elimination of being able to kick people out of your homes. Like you can't just kick someone out for not being able to pay right now. And that moratorium, I think, has been good in terms of just stabilizing, sort of freezing where we are right now. But, you know, these mortgages and rents are still going to need to be paid, you know, at some point. And the the question everybody's asking us now is, can we just freeze it, or can we eliminate those, eliminate those bills? And, you know, I wish we had a magic wand, but one thing I want to remind people is that the property owners are, many of them small business owners as well. And many of the people who are renting to others also have their own mortgages that they have to deal with. And so it's not as if, I mean, everybody's hurt. And certainly if you're low income and you're poor, this has been just devastating. We know that, you know, we have a very large percentage of people who live, work, and play in Silicon Valley who don't have any savings. And we can tell by the lines we have going to the food banks and, you know, across our county that people are really, really, really hurting. So really, in my mind, the question is, how do we as a society kind of pick ourselves up without looking at who's gore to ox, or who's, there's an expression about, like, you know, protect myself but not my brethren here. And in order for Silicon Valley, and I'll just again speak at a local level, in order for us to move forward, we're going to have to think very critically about how our fates are tied together. And the one thing I've thought a lot about relative to COVID-19 is that while it certainly has impacted communities of color and lower income communities dramatically, this virus has reminded me that we really have to think very differently about our communities at a local level, because viruses don't know the difference between people. And I remember when 9/11 happened, just thinking about all the people who died in 9/11. They were every faith, every creed, every, gender diversity, everything you could imagine. And for a very short time, it seemed like all of the United States thought, okay, we're a team, let's work on this together. And then as we started to see cracks in that, people start just looking out for themselves. I think as a government at a local level, our job is to think about how to spend our common wealth, our common resources in a way that doesn't exacerbate disparities, but really does look at how we lift people up. And so what I've been asking, and I'll just say this to all of you, because you've got a lot of young, really, really smart people who are on the line here, you know, we want your best ideas. Tell us, beyond freezes, like what would you do if you had a magic wand, and help us think and dream about what we can do better in this new iteration of what we're going to be as a country, and certainly what we're going to be as a local community. And I didn't mean to go off on a tangent. I know the legal issue, and the reason I was kind of looking at Dave, and I don't know, Dr. Matthews, a law degree may be the only thing he doesn't have, as I was listening to all his degrees earlier. I know there are constitutional issues with certain kinds of solutions. And so without spending a lot of time on those, I'd really like to think about what are the alternatives that we have.
Yeah, there's, so the Constitution of the United States says that government basically would allow government to take property, but only with just compensation. And it happens often. That's how roads get built, right through private property, bridges that take private property initially. Government projects have done that historically, not without angst, but it happens. And then there's an appraisal, and the amount of the value of that property has to be forked over by the government. In this case, the property right is the right to that payment, that mortgage payment, and that right is held by the bank. They have a contract that says that's their money. They loaned it, and they're entitled to get it back. And so if we as a government or state government or a city like New York or even the federal government came in and said, we are essentially, on behalf of the people that owe those mortgage payments, we're going to call them not due. We're going to sort of void them or vitiate them. Freeze them indefinitely would be a problem as well. Then we would have to start forking over those payments ourselves. The bank's not going to lose that money under the Constitution of the United States. They would just basically file what's called an inverse condemnation suit, an eminent domain suit, or we would have to do that on the front end to go and take those payments away. So why wouldn't we just do that then? Because the weight of all those payments just in Santa Clara County alone would collapse our government overnight. We don't have that kind of liquidity. So we've done the moratorium that Supervisor Chavez was talking about. And even then we had to make it very clear, we're not telling people not to make their payments. And we're not telling people that your payments aren't going to come due at the end of the moratorium. The only thing we can do is defer those property payments to the lawful recipient of them. And that's the jam we're in. Now, if the federal government were to print some more money, do another stimulus package and tell all the counties we're going to create a big bucket of money for you to reimburse people for their mortgage payments or reimburse banks for their mortgage payments, obviously that would work for a while, but not an easy solution.
It's not an easy solution, and I'll pick up on something Supervisor Chavez mentioned about the younger people out there and the debt that we were talking about just a minute ago. I believe the federal debt right now stands at about $24 trillion. We've passed in the 4 phases of stimulus money that we've done so far, it comes up to about $3 trillion. The House just voted on Friday for another $3 trillion, which would, in essence, with those two together, put nearly as much debt in 3 months as President Obama did in 8 years. I mean, it's just a huge amount. And I don't have a problem myself with us making sure, as if we're telling people you can't go to work, the federal government should step in and cover you. If it's stopping you from working, it's stopping you from collecting your rent or something, the federal government should step in and do that, because it becomes a takings, I think, as you were referring to. But I am concerned about how quickly we passed some of this. You had to do it quick, but I think the $2.2 trillion, phase 3, passed in something like 3 or 4 days. I mean, it was just almost, and you cannot control the kind of fraud, abuse, and so forth, spending that much money that quickly. And I just bring this up because I'm at the end of my career. I'm not going to be paying that money. Those of you at Stanford are the ones who are going to be paying it. So you have a vested interest to ensure that, yes, we make sure we get the money out there that we need to, but we're doing the best job we can to get it to the right places in the right amounts, and that a lot of people who don't deserve it and shouldn't get it, don't get it.
Hey, could I just add a point of information? It's not another answer, but for students who would like to tune in on June 3rd, I believe at 10 a.m., we could get that information for you more clearly. One of our committees at the county called the Federal Affairs Task Force, which is comprised of myself and Supervisor Joe Simidian, who actually represents the Stanford area, are going to take up this issue along with the whole cadre of county lobbyists, including our Washington lobbyists, who will be participating in that meeting. It's Zoom, so you don't have to, travel or anything, obviously. But if you're interested in the subject matter and want to do more on this subject, please tune into that meeting. Public comment will be allowed.
Okay. And with that, I just want to once again thank our wonderful panelists, Dr. Matthews and Supervisor Chavez and Cortese. So right now, for everyone, we just want to say thank you so much for participating in the past 2 days. I know that it's been a long 2 days, but we're almost over. So please return to your small groups for the debrief session, and you'll find the link in your email. And thank you again for our panelists for joining us today. And participants, please join your small groups.
Thank you.
Thank you.
Thank you very much.